Welcome back to the Mountain Morning Show. Concussions are a very real danger that concern all of us, whether we're active on the slopes or riding a bike. Really, in our day-to-day lives, concussions are a very real issue and something to be concerned about, as well as with our children who are involved in contact sports. So here to talk more about that is Dr. Kutcher and Cara Baxter from the Sports Neurology Clinic. Welcome to the show.
Good morning, thank you.
Thanks for having us.
So let's just start right away. You guys have an event on Sunday. Tell me more about that.
We sure do, go ahead.
So our event on Sunday is timed with the FIS 2019 World Championships. We have two-time Olympic gold medalist David Wise coming to speak alongside us with regards to all things athlete brain health. So we title it Athlete Brain Health Beyond Concussion. So we will address concussion, we will address post-concussion syndrome, but we also want to raise awareness to things like sleep disorders and headaches and mood disorders, and kind of shedding light on all of the things that athletes can address on the front end in terms of their neurological health without having to have an injury.
And this is this Sunday at Utah Olympic Park. What time?
2 p.m.
2 p.m.
Yep.
And it's just for anyone who wants to come.
It's totally open to the community, completely free. We'd love to have anyone and everyone.
So what do you think is the biggest danger with athlete brain health? What do we need to be most concerned about?
So the biggest concern really would be to protect the health of the brain throughout the lifetime. And so it's not about, concussions are important injuries. It's one of the biggest myths out there right now is that concussions have long-term effects. Mm-hmm. Concussions themselves do not. They are injuries that go away. It's repetitive hits over time that may impart some risk to brain health in the long term. And so our program and what we've dedicated our professional lives to is really shedding light on those important topics, that concussions are serious, but treated correctly, identified, treated correctly, you can play sports, you can play active sports, even contact sports, in a safe manner. And it's more about monitoring brain health for the long term, and that's what we're about.
And how do you do that? I'm sure it's a complicated
That's a great question.
rubric of things, but...
And I'm sure a lot of folks watching have had experience with attempts to try to oversimplify approaches to concussion, whether it's symptom checklist or using a computerized preseason test to look at brain function. The reality is that brains are complex, people are complex, every case is different. And really the only way to evaluate and treat brain health is to come at it from a comprehensive neurological perspective. So that's why we're neurologists that do this and physical therapists who have neurological training to look at the bigger picture of brain health. So it's really about getting to know people on that level, and it's not just about check boxes and simple tools that don't really give us information that we think they do.
I noticed that your clinic specifically, you recommend kind of a pre-evaluation so that you know the athlete, you know where they are normally, I guess, and you're not just seeing them after an injury. So tell me a little bit more about that.
Yeah, absolutely. So as Dr. Kutcher was just alluding to, our baseline, we really try and get to understand the individual in front of us. It's very common for someone to experience headaches or dizziness or fatigue, kind of just everyday life, right? Like we all experience that. Additionally, we look at kind of their eye movements and balance, and again, look for normal variance just at their baseline level, because if you take someone after a head injury and you don't have that baseline information and they present to you with what might be an abnormality, you almost have to attribute it to, okay, you hit your head, we have to err on the side of caution and attribute this to your head injury. But if you know that individual at their baseline and yes, this person already suffers from headaches and sometimes they are tired and their balance was terrible even before this, then we can start to really approach it from kind of a large differential diagnosis and look at other pieces that might be at play, so we're not taking someone away from their sport unnecessarily.
Definitely a very kind of holistic approach in that I think a lot of times you get a concussion, you go to the ER, they assess what they see, and then they release you. But you're going to help before, during, after, kind of the entire picture of the athlete's brain. Oh,
that's right. And we're also more about more than just concussion too, because things that Cara alluded to, migraine, headache, attention issues, sleep issues, if we identify those, we can make you a better student, a better athlete, and more productive just in general life. So we're more than just a concussion program. We're sports neurology, so it's all aspects of brain health human performance, behavior, cognition, and applying that to making people have the best possible lives.
Who should be concerned about this? Professional athletes, kids in playing football? What athletes do you work with mostly?
Well, what you would think. So the sports that have the most contact risk, the most impact risk, are the ones that we're the most concerned about. But frankly, concussions can happen in any sport, any situation in life. So we have a very wide net that we try to address. But certainly the patients that we see the most are the extreme sport athletes, football athletes, and other sports that have a lot of contact as part of the nature of the sport.
Now, if someone wants to reach out to you guys, you have 2 different locations pretty close by, correct?
We do.
Yep, so we have one right in Pine Brook. We're located inside of Athletic Republic in Quarry Village. And then we have another clinic location down in Sandy, Utah.
Perfect. So with this event, what kind of athletes are you hoping to come? What kind of people, really, from the casual weekend mountain biker to the pro skier? Who do you hope to have there? Who is this geared to, I guess?
Everybody,
Everybody.
really. Every athlete, every level, every age, every ability. Every age. I mean, everybody needs to kind of know about this and have the best possible foundation of information going forward.
And any kind of red flags, anything that you think someone definitely needs to go in and see you right away?
So anytime you're concerned about a change in that person's brain function, so whether that is cognitive things, memory, attention issues, mood issues, headaches, sleep, those are all extremely important. Certainly anytime somebody's had a hit or experienced force, and you don't have to get hit to the head to have a concussion, so anytime there's enough force experience that the brain is moving in a quick fashion, it's worth coming in to see us, because one of the common things we see is that since people have tried to oversimplify this approach, any hit with any symptom must be concussion, and that's not the case.
Okay.
There are a lot of other things that can cause symptoms, and so we want to see people as soon as possible, same day, next day, so that we can get the diagnosis right first, and then and set that person on the best possible path going forward.
Where can we get more information about your clinic and also this event on Sunday?
So you can find out more information on our website, www.thesportsneurologyclinic.com. You can also email me directly, cara.baxter@thesportsneurologyclinic.com.
Yep.
And quickly before we have to go, what made you guys decide to get involved with brain health?
Well, I grew up playing hockey, first off, and so I understand the athletic mindset and had concussions myself over the years. And as a neurologist, I went into the field because that's what's the most important thing to health is your brain. And so we saw a huge gap in good neurological care in the athletic setting, and really every day we're making a difference in people's lives, and that's why we do what we do.
What about you, Cara?
Yeah, similarly, I was seeing these elite athletes getting yearly physicals, and the orthopedic side of things was so well covered, and even cardiac. And then neurological health was kind of pushed to the wayside, and I would have these athletes come up to me with mood issues or headaches or sleep problems, and they just kind of felt like they had to suck it up and deal with it. That was part of being an athlete, and that just didn't sit well with me as a healthcare provider. And I was like, well, wait a minute. We can do something about this. You don't have to see a neurologist only when you have a concussion. You don't have to see a physical therapist only when you have a specific injury. There are things we can do on the front end to improve your quality of life and your athletic performance.
Well, it's wonderful having you here, Cara and Dr. Kutcher. I think it's just incredible what you guys are doing, and it's great information for me and for actually my children, who I have a football player and a soccer player, so thank you so much.
Well, we're here to help. Thank you.
Absolutely. We look forward to seeing everyone on Sunday.
Sunday, perfect. All right,
Thanks so much.
that is the Sports Neurology Clinic. Athlete brain health is essential. We're so thankful that they are here joining us, and check out their event Sunday at UOP. All right, we'll be right back after this quick break.